Okay. Well, haven't you written anything?
No, unfortunately, I couldn't write the letter
Okay.
today.
Right. So let's have a look. This is so Doris White. Okay. Writing regarding Miss Doris White, 64-year-old lady who is recovering from a neglected leg injury with a skin graft. Okay. Uh, okay. To your service for wound dressing. Right. Do we need to put a comma somewhere?
After lady doctor.
Yep, I think so. A 64-year-old lady who is recovering from a neglected leg injury with a skin graft. Okay, and
Yeah.
now so basically we had a sentence. I'm writing regarding Miss Doris White to your service for wound dressing. Okay.
Yes.
Uh,
What about after lady? Do we need any comma?
no, nothing. No.
No.
But do you think you could say actually I'm writing to refer instead of
Okay.
saying regarding? Okay.
Mhm.
8 weeks ago, okay. At the beginning of sentence, we don't write numbers, okay? 8 weeks ago, Miss White was admitted to the hospital, was admitted to the hospital due to to uh, neglected traumatic leg injury. Um, should we say a neglected traumatic leg ulcer?
Yes, you
Yeah,
can.
instead of injury, okay? Um, Firstly, during hospitalization, in her wound healing, no improvement was seen. Okay. Um, so I think we should put this here actually. Uh, right. No improvement was seen or was noticed or what was perceived in her wound healing. Therefore, a surgical debridement and after that a skin graft with a flap was performed under general anesthesia. Is that important for a nurse?
No,
No.
doctor. No.
Okay, so we take that off. And in order to wound healing, hyperbaric oxygen therapy and negative pressure dressing was used. And today the graft healing was improved or improved to 70%, and ABI was enhanced from 60 to 70. Okay. Uh, in order to wound healing, we can't say actually like that. We can say for wound healing, okay. In order to, usually it's followed by an infinitive. For example, in order to heal, okay, the wound. Where is that? Here. Yeah. In order to heal or something like that. So here we can say for wound healing, okay? It's
We
probably...
don't have your screen,
Oh,
doctor.
you don't? Okay. Why is that? Having trouble today? How about now?
It's good.
Okay. So in order to is usually used with a verb, okay? So wound healing is not a verb. So we say for wound healing, okay, comma. Right. And do you think this is again relevant for the nurse?
No.
No.
Doctor, I state that this is a nurse for dressing the wound, and I think that if she know what we have done for the wound, it's appropriate.
Yeah, but this is in the past. So actually, when we are referring to a nurse, it doesn't really matter much about how we have managed it. Okay. But the only what is significant is that we have done a skin graft, okay, and the other information is absolutely relevant. She lives alone with her cat and independently uses a frame. Also, okay, we can do that as a capital. She is on social services registry for laundry and cleaning. Regarding her past medical history, she has type 2 diabetes, ischemic heart disease. Do we need to use capital?
I should, doctor, I know that I couldn't edit this now. Yes.
Okay.
Mm.
Hypertension, coronary renal failure, in which she, sorry, for which she is on regular hemodialysis. Okay. The list of her medications, his medicines, is attached to the letter. In view of the above, because of, because of, it's redundant. Okay. In view of the above, possible infection and accelerating the healing for to prevent. Yeah, we can say to prevent possible infections and accelerate the healing. Okay. The wound dressing is necessary and vital. Consequently, I introduce Ms. White to your services regarding her nursing management. Okay. Sorry. If you had any queries, please contact me. Okay. If you have any queries, yeah. And yeah, we could actually put a comma here. Yours sincerely, Dr. Sharafi. Okay, that's good, actually. So, yeah, except for some extra information. And do we need to say to prevent possible infection and to accelerate healing?
No.
Well, we don't need that really. Okay, and these connectives, I mean, these like this. There was something here also.
Doctor, actually, I needed to increase the count of my words.
No,
For that,
you don't need that. It is as it is now. It is 205 words. You didn't need to increase that. Okay.
oh, I
Uh,
write that it gets 205.
It is okay. 180. We don't want extra information. Okay. Okay. So we put that on desktop. Okay. Right. Well, you can actually, you would probably score a B with this. Um, just you need to improve your grammar a little bit, okay? Just to, and you actually need to say refer instead of introduce. That is because you're actually referring, okay? Any questions?
No.
No? Okay,
No.
so basically you have done a good purpose paragraph. You have actually said what the situation is now. That a patient with leg ulcer and with skin graft, and okay, and then you said you talked about background and then the plan. Good. Okay. So who's next? Oh, this is Mr. Krog. All right. So this is okay. I'm writing to refer Mr. Santini, a 67-year-old lady, Mrs. Santini, with worsening of chronic osteoarthritis, significant pain, and a lump on the back of her thigh, a right knee joint, for further management. Okay, good. Mrs. Santini has come to see me today with a 6-week history of progressive knee joint pain, especially during movement. Okay, so we could actually put a comma here, and a 4-week history of a lump on the back of her right knee joint with restricted mobility and mild to moderate persistent pain. She cannot, well, cannot is actually one word, okay, and she cannot do normal daily activities such as shopping, distance walking, and has had difficulties in climbing stairs recently, okay, in climbing the stairs recently. And if you put recently here, then you need to probably put a comma here. Her depressive symptoms such as irritability and agitation has also increased. Okay. What's that? Upon examination, she has crackling sounds during joint movement, but does not have skin changes, swelling, or joint deformity. MRI has shown degenerative osteoarthritis. Okay. Mrs. Santini has had osteoarthritis for 12 years and undergone lumbar laminectomy 7 years before and bilateral hip replacement with good results 5 years before. She also has hypertension, hyperlipidemia, and I think hypertension is with S, and hyperlipidemia, okay, and paroxysmal atrial fibrillation. She lives alone, okay. I would appreciate if you could see her for further osteoarthritis management, possibly joints, steroid injections, and refer to a physiotherapist for improving joint mobility and to district nurse for home assessment. Okay, well, the orthopedic surgeon doesn't refer for district nurse. You should do that yourself, okay? And
Okay.
again, with the physiotherapist, you need to do that yourself, and the orthopedic surgeon doesn't do that. Okay, but okay, good. How about her depressive symptoms? Is it relevant to this doctor or?
Not
I think
relevant.
because of
but
pain, she has depressive symptoms because of pain and not doing daily activity.
Okay, so we could probably put that. I mean, we take that out of there and put it here. Okay, it's in the background.
No, it is her. It is a new complaint.
Is it?
Yes,
Okay.
Yes.
it is new complaint.
So
Okay, and then refer to physiotherapist. Where should I put it?
yeah,
Refer
you
to
can
physiotherapist.
you can put it in the last exactly in the last paragraph. I mean, you can say a referral for physiotherapy and district nursing team has been made, but I would appreciate if you could see Mrs. Santini for further management of her osteoarthritis and possibly steroid injections. Okay, so that's something we could do. Okay, right. So Yeah, because as you are the person who's responsible for care of this patient.
Yes.
We don't actually ask other clinicians to make a referral, and that's good. And that is 198 words, and that is very good. So this is the present situation. This is the
Yes.
background, and this is the action required. Very good. Uh, in fact, I just think you need to say, you need to emphasize this is something new. When I read this, I thought she has depressive symptoms and they have increased or they have exacerbated. So I was probably mention she's developing depressive symptoms. Okay. She has developed depressive symptoms such as irritability and agitation. Okay, so I would say probably. Okay, very good. Yeah, that's I'm quite happy. Um, uh, just remember the specific names have start with a capital letter. Okay, and surgeon. We usually say orthopedics department, and it is orthopedics. Okay. Maria Santini. Okay. Dr. Clark. And what do I put down here?
Yours sincerely. Yes.
Okay. Right. Good. I'm happy.
Thank you.
Okay. So put this on the. Okay. And this one is.
Yes.
Okay. I'm glad you're back. I hope that you would have good news from now on. And I'm sorry to hear that you had problems. Okay.
Thank you, Doctor.
Okay. So, yeah, some extra spaces, and I just don't say that I have OCD. I don't have OCD, but
Doctor, I have a question.
yes.
In the first line of each paragraph, do we need to write the first word a little forward and
No,
not at
no,
the base
no,
of the line?
no. We don't need any margination. No.
Okay. I think in IELTS is it in such way. Am I correct?
No, we have we have two types of letters. I mean, in the old times, when there were no computers,
Okay.
we call that indentation. They did in an indentation without a space between the two paragraphs. Now this is called the block type, and so everything starts from here, but between the paragraphs you just skip one line. Okay, so that's how it is now. So you don't need any indentation. Right, tracking changes. I'm writing to refer Miss Doris White, a 64-year-old lady who is recovering from a skin graft on her injured leg for ongoing wound care. Okay. Is she recovering from a skin graft?
Yes.
Recovering from skin graft. Doesn't sound okay. So you recover from an illness or from a problem. Skin graft is not something you recover from. Okay. So you can say who has had a skin graft, okay? Who has had a skin graft on her injured leg for ongoing wound care. Good. Miss Doris, Miss White, actually, okay? So had a neglected traumatic leg injury during a sudden sleep in bathroom about 55 days ago, okay, about 2 months ago. Although she was treated with analgesics, antibiotic, topical pressure therapy, and even surgical debridement. Okay, just a comma.
Yes.
Her wound did not heal, did not show any healing, or did not. Okay. Right. I suggest we say, although she has been treated, her wound has not healed. Okay. Has not healed, and therefore a skin graft was performed. Skin grafting was performed for her 3 weeks after injury. Fortunately, her skin graft healed gradually up to 70%, and her ankle brachial index changed from 60 to 70 during hospitalization. Okay. Yeah, we don't need a comma here. Regarding her social and medical history, she has good mental health, lives alone, and walks on her own. Okay. With the help of a frame. She's under support of the social services registry. She's on the registry or under the support of social services. Okay. So for laundry and cleaning, she has type 2 diabetes mellitus, skin disease, chronic renal failure, on regular hemodialysis and hypertension, on regular medication. So we need sentences, okay? She is on regular medication as before. With regards to her skin graft, I would appreciate if you could change her wound dressing for ongoing wound care. You can call my phone if you require further information. Yours sincerely. Okay, good. Right. So we can say yes. Go
For
ahead.
regular hemodialysis, should we write a sentence? Chronic renal failure, unregular. She is unregular. Is it okay? Like case note.
Yeah, I would say it's probably better to say chronic renal failure with regular hemodialysis. Okay. The social services registry. So we can say she is on the social services registry, or she is under the social services. Okay. So on the registry or under the social services. Well, that's good.
The attempt has been treated and has not healed, but now it has been healed until 70 percentage. But I think that 10th time is not prepared
Yeah.
for the situation.
Okay. Top options and even surgical wound has not healed. Therefore, skin grafting was performed for her 3 weeks after the injury. Her skin graft, yeah, we can say has healed. Yeah, that's better. Absolutely. Okay.
And the upper has healed. I think that simple past is more better.
For which one?
When we want to say that she was treated with analgesic, and after that her wounds did not heal. Therefore, skin grafting was performed. Not healed, because after that it get healed.
Okay.
I don't know if I'm correct or not.
Hmm.
Better to
I think although she had been treated with
Mhm.
analgesic is better, for
Yep.
yes.
example,
Our
had
Dr.
been
Vessel, I
treated.
use had
Yep.
yes.
Okay.
In my best I use had been.
Okay. I agree. Okay. Therefore, skin grafting was performed for her 3 weeks after the injury. Okay. Right. Okay. What is it about ankle brachial index? So, could we say ABPI or should we explain that?
Because she's a nurse of dressing, I think she knows that what's ABI.
Yeah, it's probably she knows. Okay. What is the significance of ABPI?
Edema,
And
infection,
okay. What else?
Circulation, I think.
Right. Okay. So,
It,
why is it
it will
relevant to the
access
nurse?
the artery, yes.
Why
She
is
I
it?
should
think
pay
it is not
attention to
related
them.
to nurse.
Say that.
She pay attention to them, doctor, when nursing the patient.
Okay. Right. Uh, so, what should we do when we're doing a dressing to make sure that there is no problem with circulation?
checking the pulse,
Okay. And
Color, skin color.
okay. Okay. Right. So, what
I
do you?
think it didn't don't relate to dressing for nurse.
It is very relevant. It's actually just to tell the patient, just to tell the nurse that you shouldn't put too much pressure. Okay, so make sure that the dressing is not too
Too
tight.
tight.
Okay, so
Okay.
pressure dressing is contraindicated in patients with grafting. Okay, and therefore here, because ABPI is 60 to 70 now, it is they need to pay attention not to put any pressure and not to elevate the leg. Okay.
Oh yes. Yes. Okay. Thank you.
Okay. Good. Well, I'm happy. I think mm, I think that what you have done. I mean, you have selected the correct information, and you have done the correct setting. Okay, your organization is good. This is 200 and 190 words. Okay, so I think it is. You can score a B with this. Okay, you will score 350 at least. In order to get A, you actually should not make any grammatical mistakes, and you should also say that please pay attention to the pressure dressing, to not to put too much pressure or elevate the leg because the ABPI is 70. What is the normal ABPI?
Upper than 90.
Okay, it's above 90. Okay, that's 0.9 or 90. Okay,